So I've just finished week 2, moving on to week 3. So week 3 is the upper, week 2 is lower. My biggest takeaways from week 2 would be just kind of breaking the assessment down into, you've got like your subjective, objective, and then you're going to go through like your movements, so your active, passive, active with overpressure as well. And it just kind of makes it a little bit easier. Breaking it down again into your planes of movement as well makes it easier for you. I think it's probably quite hard to get stressed out with all the movements and stuff when you're doing when you're under pressure and you've got someone start looking at you being like, what is it that I'm doing? But you just need to start thinking about how you're going to break it down, what side is it that's affected as well, and work around that, so making sure that you're doing the non-affected side first. Yeah, and it's pretty straightforward. I'd definitely say that week 2 was one of the biggest modules. It's quite lengthy, some of the videos are really long as well, so it's quite hard I had to keep having to stop and kind of regain my concentration and then go back and watch it again. It's quite good as well just to make some notes and then re-watch the videos, because I think sometimes you don't always go in the first time. So I'd definitely say that it took the longest this last week. As well with like work and stuff, it's been quite busy here, so we've been doing like half-price massages just for the sake of getting the assessments done, getting some practice in, and also setting up the gym as well. So it was our first week starting at the gym, so I've had the gym, the assessments, and also the mentorship as well. So yeah, but it's been good. So we're going into week 3 now. This is the upper limb. I'm definitely looking forward to this one the least. So I have actually had a year out from uni since, and then now starting this again. So I'm kind of like, I've dropped everything. I physically cannot remember a single thing that I did at uni for the upper limb. I've just kind of got the structure set in my head on how to do an assessment, but even that's still so lengthy. Like there's just too much to remember on that. But yeah, I don't even know where to start when it comes to the upper limb. So I'm quite nervous for getting this started. I know that it's not going to be as hard as the lower limb, or as lengthy, should I say, so I guess that's one advantage for that. But yeah, I think it all just comes with practice. I think it's definitely just a case of I need to get the knowledge in my head from the mentorship and then put that to practice with doing the actual assessments as well. Another thing as well that I'm quite nervous for is we do what's called an in-service at the end of the week here at the clinic. And this Friday, it's basically all the pressure's on me. You've got everyone looking at me doing an upper limb assessment as well. So yeah, I'm quite daunted for that, so no pressure.
So we're just going to talk a little bit today about treating the tricep. So where we're going to treat the tricep really, Sarah, is obviously if we're restricted to elbow flexion, that's going to be a big one because the tricep's going to have to lengthen. If we get like pinching in the joint, it can be quite a big one as well, because if this can't lengthen, it's going to affect the axis of rotation of the elbow joint. Also then we've got like our testing from objective assessment, especially some of those coordinative tests, if they're pointing towards a posterior lateral shoulder injury, we might want to treat the tricep definitely for that. So people that come in with like shoulder impingement, or even like your cervical spine patients who have a lot of upper trap issues, if our coordinative testing is pointing towards a posterior lateral issue, we might want to treat the tricep for that. Okay. Does that make sense? Yeah. So if I'm going to treat the tricep, the first thing I'm going to do first of all is I just want to be able to restore the ability of that myotendinous junction to like tolerate load. So I'm going to come off the myotendinous junction, literally just load into the tissue, and then from there I'm just going to get you to actively just bend your elbow as far as you can. And you can use your other hand at the end just to give it a bit of overpressure. So I just want to get as much range back as possible and then relax back down again. So I'm loading off the tendon into the direction of the muscle fibers, bend the elbow all the way up and back. And I'm really focusing all across that myotendinous junction. Now this distal triceps got quite a big tendon, so I might need to do quite a lot of work. You can see it's a little bit tender there. It's not the nicest release in the world. And then I'd work right up to that proximal tendon as well. The proximal attachment, especially like the attachment of the shoulder blade, that's going to be big for a lot of like scapular issues. Okay. So for that, I might then get you to start moving the shoulder. So I'd still probably get you to bend the elbow fully first, and then I'd probably get you to flex into the shoulder a little bit just to get a bit more length for the proximal tricep. Yeah. Obviously, I'm going to treat. Once I've treated, what am I going to do? Yeah, before I do that, just retest. Right. So I'm just going to recheck. So again, I'll go back to those tests that kind of pointed towards that posterior lateral issue, and I'm going to recheck those. If I've got the result I want, I'd probably do a little bit more, and then I'll move on, like you said, to the isometrics or the next stage of rehab, progress them a little bit in terms of the rehab, and then move from there. Okay. And obviously then we can use our passive assessment to really break down whether we're going to treat the distal mainly, or whether we're going to go more towards the proximal. And this is where you can really save yourself a lot of time in terms of your treatment sessions. We do half an hour treatment sessions here, and to get down to the half an hour, you just need to be really kind of slick with your assessments and find the true stressors and the tissues that you really need to treat, so that you're not wasting your time treating other tissues. Not that it's a waste of time, but it's a lot more efficient if we can just get straight to whatever tissues are actually contributing to the symptoms, and whatever tissues are contributing to the true stressor that's led to those symptoms in the first place. And if we can have an assessment system that kind of points and kind of lasers or targets on those, we can save a lot of time that we usually spend just like massaging the tissues, etc. So rather than massaging the whole tricep, we can really focus on that specific portion of the tricep that needs to lengthen, or that specific portion of the tricep that we need to improve its tolerance to load. That kind of makes sense. And then we can really take that concept and apply it to any tissue in any limb, but especially obviously for module 3, it's going to be the upper limb. Forearm flexors are a big one as well. Again, we use our hands all the time, in general, being on our phones, being on computers. Forearm flexors are a big one that normally needs some help to lengthen as well. So that's basically it. And then it's just applying that to the specific tissues that we're going to get out of our objective assessment.